I know that opiate addicts, their biggest fear is withdrawal. I know that. I was an opiate addict at one time, and I know what that feels like. And so with medicated assisted treatment, a lot of them have told us it allows them to get past their cravings so that they're able to focus on other areas of their life, their mental health, their employment, their families. And that's so rewarding.
So when determining the best treatment protocol, we really have to look at not only their drug use, but their environment, their motivation, and really consider what they want. Also looking at what they've tried before and what may not worked. So no, there isn't one treatment that's going to work for everybody. Here we offer Suboxone and Vivitrol.
Helps with the client's cravings. It helps with blocking, like Suboxone is an opiate partial antagonist and it's a partial opiate blocker. Vivitrol is an opiate blocker.
The nice thing about Suboxone is that although it also has buprenorphine, a synthetic opiate in it, it has an opiate blocker, naltrexone, as well. And so clients don't, when they're in the program, they are on their dose of Suboxone and they don't have to go up. They're not building tolerance to it. So they're staying at the same dose. So it seems like there's more hope there of them getting off of it.
The stigma of MAT is the same thing I felt when I got here. You're still, a drug is a drug is a drug. Addiction is a disease. And it's not any different than heart disease. It's not any different than kidney disease. And you're taking a medication for it. Suboxone is your medication to keep your disease at bay.
There's a really big difference between abusing a drug and taking a drug that a doctor prescribes you in the manner that the doctor prescribes. The latter is doing something positive for your health. And if you're doing something positive for your health, you're also helping your recovery.
The stigma will cease. It will maybe not become non-existent, but it'll lessen as they start seeing their community members become an active part of society.
In our Suboxone program, when clients are first starting out, they're typically coming to 3 groups a week. Our Suboxone groups are an hour and a half each, and they're typically having an individual counseling session 1 to 2 times a month when they're first starting out. They're also picking up their Suboxone prescription on a daily basis at the pharmacy. This is because in the beginning, they're still getting stable on Suboxone. And we're giving them a chance to really start adding some structure to their life. And it's a really crucial phase because oftentimes this is a phase where somebody is discontinuing their drug use. So we want to provide a lot of support at that time.
So we keep them on monthly, so it gives them a chance to establish a foundation and start and get a routine in their life. And we found that they do much better.
We're also asking them to attend at least 2 sober support meetings per week. So when people start out in the program, it is quite rigorous, but as they move forward and progress, the treatment becomes less. We continue to monitor them with groups and UAs, but not as much as in the very beginning.
And that is one of the requirements that we do for them. We require of them is to start getting their lives back on track. So they're in this monthly group for a year. What we want to see happen in that year is a job, their own home, maybe their children back, a regular network of support groups. And the one thing that we've noticed here, we had a struggle with them getting into going to support groups twice a week. So we started involving one support group, and you can do a clean and sober activity.
So we really want their program and their treatment plan to reflect who they are and be supportive of success for that individual person.
Which is really much more embraced by them. You know, if they can go to the health and wellness, if they can go to a powwow, if they can go to a sweat lodge.
We definitely cater each treatment plan to the individual, and we really consider what each client is doing.
Because they've had a family history that has been enmeshed in drugs and alcohol. Many of them have strayed from their traditional ways, their cultural ways.
And what clients are telling us who are on Suboxone in particular is that before they had Suboxone, they had such severe cravings and really weren't able to sustain their recovery for long enough to really get to that spiritual component of recovery that's so important. So we absolutely incorporate the medicine wheel into our group structure. We absolutely incorporate, the spiritual aspect. We encourage those things. And by no means does it replace that component at all. That's still a very important pillar of recovery.
We do our best to fit culture into every aspect of their recovery. Their culture is a spiritual way of life. So that is our goal, to get them back to who they really are.